Brought to you by GTA. We start with you.
They haven't given me, they haven't really given me directions. I've asked for them to email me what exactly I'm supposed to do. They still haven't emailed me. This was since last week. They haven't emailed me.
36-year-old Shauna Camacho says on February 25th, she decided to get her two children, ages 3 years and 8 months old, tested for COVID-19 at a private clinic after experiencing cold-like symptoms. After receiving a rapid test, Shauna was the only one who tested positive. That same day, she and her family went to another private clinic to get another test. This test was a PCR test and was notified 24 hours later that she had tested negative for COVID. And on March 1st, Shauna took a third PCR test, and the results again were negative.
And I've also told public health that my PCR is negative, but it's like when I tell them that it's negative, it's like they didn't. You know, it's almost like they're avoiding it, and then they go on to ask me, like, who lives in your household? What are the names of your kids? Because they're probably positive as well. And so when I heard that, I said, my PCRs are negative. I had my son tested, and my son's PCR was negative as well. How could he have COVID? I said, isn't it possible that it could be a false positive? And she said, yeah, it could be. And then she moved on to ask me the next question. She doesn't entertain my questions.
So what happens in instances where people believe that they may have received a false positive test result? Public health spokesperson Janella Carrera.
If the individual is concerned about that first positive result, for example, if they were previously positive or if they are questioning that positive result and they're not confident that that initial positive test was in fact a positive test, or they may be concerned that it might be a false positive, then of course they can raise that concern with public health officials and ask to be retested.
Late this afternoon, Shauna said she was informed by public health that she is released from isolation, but her two children must stay isolated because they were exposed to a supposed COVID patient. Her. The entire situation has left her exasperated and confused. Public health says they are currently working with the patient to resolve the issue.
Brought to you by GTA. We start with you.